All right, so we're going to talk about tourniquet applications, how to apply it correctly per our policy. The first thing, so the tourniquets obviously were used to, if you're working on an arm, leg, it's used to cut off the blood flow so there's limited bleeding. It's important though that we put this on correctly so we don't damage the patient's skin or injure them, and that it works properly. So the first thing we want to do is, obviously, once we get the patient in the OR and they're asleep, we're going to confirm that the surgical site's been marked. And then we're going to put a soft, I'm just using a towel for this example. I would really use like sheep cotton or something like that, web reel, to wrap around the leg where I'm going to put the tourniquet. Let's say we're working on the knee, so I want it as high on the thigh as I can. So I've got my padding on. I've got a helper too that's probably lifting the leg up to make it easier. So this tourniquet has the tubes. They get thrown off and hooked to the tourniquet machine. We're doing this unsterilely. You can do this sterile. You would open the sterile tourniquet to the field. The surgeon or whoever would apply the tourniquet and then hand the unscrubbed circulator the ends of these cords, and they would plug them into the tourniquet machine. So it's got the hoses, it's got a tie, and it's got a Velcro strap. You want to orient this correctly, where if you're working at the knee or the ankle, you want the tubes running away from the surgical site. So they're going to be pointed up. I'm going to undo it. Put it around the extremity. So usually I'll have help. This will be a lot easier. Now I'm going to secure it. I'm going to pull this top strap over. I'm going to take these strings and pull against. So I'm doing light pressure. If I do a lot of pressure and I make it too tight, it's going to go ahead and create a tourniquet. It's going to trap all the blood down here. I'm going to place the Velcro, and then I'm going to tie this in a bow. Extra little security measure. You want to make sure that when you put it on that you have an overlap of about 3 inches, but no more than 6. If you can't achieve that, then you need to use a different size tourniquet. Now these would get hooked up to the machine, and I'm ready to inflate the tourniquet when the surgeon's ready. Sometimes I'll put a drape here to drape this off, and then I can prep my leg. Typically for the leg, it's going to be a 24 or 34 inch tourniquet. Your pressure is going to be anywhere from 250 to 350, surgeon preference. On the arm, your typical size will be 18 inch to 24 inch, and your pressure can be anywhere from 200 to 350, just surgeon preference on that as well. You want to make sure you're alerting your surgeon, you're communicating the time that the tourniquet's been up. Usually we have ours set on a 60-minute timer, and at that point we're updating the surgeon every 30 minutes and adding more time to it and charting that in our document. After surgery, you want to take this off and look at the skin site and make sure there's no skin damage. If there is, you need to escalate that per your policy, chart that in your record as well. You also want to make sure before surgery that you're looking to make sure that they don't have any bruising or anything, any kind of skin issues before you put the tourniquet on as well.